Welcome to our channel. Today we're going to talk about something incredibly important, the warning signs of an impending stroke. Knowing these signs could save your life or the life of someone you love. Strokes are more common than you think, and they can happen to anyone at any age. But the good news is that recognizing the signs early and seeking immediate medical attention can significantly improve outcomes and reduce the risk of long-term complications. Over the next few minutes, we'll delve into 10 critical warning signs of an impending stroke. Remember, time is brain, so every second counts. Let's get started. Have you ever felt sudden tingling, numbness, or weakness in your face, arm, or leg? This is a common sign of a stroke, usually affecting one side. Imagine you can't lift your arm to grab your coffee mug, or you try to smile, and one side of your face droops. This is caused by a disruption of blood flow to the brain. Seek immediate medical attention. Time is crucial. Our brains process information, language, and communication. When a stroke strikes, these functions can be impacted. Imagine trying to express yourself, but the words won't come out. Speech may sound jumbled and incoherent. This is known as aphasia, a common stroke symptom. Strokes also affect understanding others. You might feel confused or disoriented. These difficulties stem from damage to the brain's language centers. Seek immediate help if you notice sudden confusion or difficulty speaking. Our vision is precious. Sudden changes in vision could signal a serious medical emergency like a stroke. Imagine reading a book and suddenly your vision blurs or you see double. Or you lose vision in one eye as if a curtain has been drawn. If you experience sudden vision changes, seek immediate medical attention. Our sense of balance and coordination is something we often take for granted. But when a stroke strikes, these abilities can be severely compromised. Imagine this. You're walking and suddenly you feel unsteady. You might stumble or lose your balance completely. This can be accompanied by dizziness or vertigo. These symptoms arise when a stroke affects the cerebellum. If you experience sudden dizziness or difficulty walking, seek immediate medical attention. We've all experienced headaches at some point in our lives, but a sudden severe headache that comes on without any warning and has no apparent cause could be a sign of something more serious, like a stroke. This type of headache is often described as the worst headache of my life and can be accompanied by other stroke symptoms like nausea, vomiting, and sensitivity to light and sound. While the exact cause of this type of headache in relation to stroke is still being studied, it's believed to be linked to a sudden increase in pressure within the skull, possibly due to bleeding in the brain. If you experience a sudden, excruciating headache that's different from any headache you've had before, especially if it's accompanied by other stroke symptoms, seek immediate medical attention. Imagine you're having a conversation and suddenly their words become jumbled and meaningless. This sudden difficulty understanding speech, known as receptive aphasia, can be a sign of a stroke. A stroke occurs when blood flow to a part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. It affects your ability to comprehend language, both spoken and written. Seek immediate medical attention if this occurs. Our bodies perform complex movements from walking to playing instruments. These actions rely on brain muscle coordination, disrupted by a stroke. Imagine missing your coffee cup or fumbling with buttons. This sudden loss of coordination, called ataxia, affects daily tasks. Ataxia occurs when a stroke damages the cerebellum. This leads to clumsy movements and difficulty with fine motor skills. Seek immediate medical attention for sudden clumsiness or balance issues. Chapter 8. Sudden trouble with swallowing. Swallowing is a complex process involving multiple muscles and nerves working in harmony. A stroke can disrupt this coordination, leading to difficulty swallowing, known as dysphagia. This can be frightening and increase the risk of choking or aspiration. If you experience sudden difficulty swallowing, seek immediate medical attention. Sudden trouble with memory. Our memories shape our identities and experiences. A stroke can profoundly impact memory. Imagine forgetting mid-conversation or forgetting why you entered a room. This can be a sign of a stroke. Strokes affect memory based on the brain area impacted. Seek immediate medical attention for sudden memory issues. Sudden trouble with emotions. Emotions are a complex tapestry of feelings and responses. A stroke can disrupt brain chemicals and pathways, causing sudden mood changes. Imagine being overcome with sadness, anxiety, or anger out of nowhere, or laughing or crying uncontrollably without reason. These shifts, called emotional lability, are common after a stroke. Damage to the limbic system can exaggerate emotional responses. Thanks for watching. If you found this video helpful, make sure to check out our other videos on similar topics. Don't forget to subscribe, like and share, and hit the notification button for more interesting videos. Stay healthy and stay informed. Please note, this video is for informational purposes only and is not a substitute for professional medical advice. If you suspect a stroke, seek emergency medical attention immediately.